Hi guys, so I wanted to do a video for you to show you a way that you can assess your own pelvis at home. It's not a perfect assessment to do, it is just one assessment on its own, but it is a way that you can get more of an idea of what's going on and a baseline from where to start. So what you're looking at doing is sitting on a chair, and all you're going to do, nice and simple, is take one leg over the opposite leg and into that position. Okay, so from here what we're looking at is comparing the left and the right sides, so they should both be the same when you take the legs over. So wherever this knee is in comparison to the floor, so how far it is from the floor, okay, the other side should be exactly the same. They should feel the same. Okay, so from here we're going to swap it over, and you'll see that this side is a hell of a lot higher than the left side. Okay, so this is a side that I do have a few problems with. So this does tell me that I do have a little bit of an issue with my pelvis. They're not quite it's not quite perfect, if you like. So what we're aiming to do is try and get these legs pretty much the same distance from the floor. Now what I would do is, this only tells us there is a problem, it doesn't actually tell us where from. So this is where you have to start doing a little bit of an investigation work. If you have this same issue, what I would then suggest is looking at doing leg press. I will stick the links to the videos in the comments. So you're looking at doing leg press, and then you're looking at reassessing. Okay, so you do an exercise and then you reassess. So if it then drops down and it feels more, it's moving more freely, then you know that was a problem area, and that's what you will then stay focused on. If it doesn't work, I would then suggest moving on to maybe forcing, which then focuses more on your piriformis. And again, you test, you do the exercise, and then you retest it and see if it changes anything. If it does, again, we know that's an area that needs a little bit of work, so then you would stay working with forcing. Again, if forcing doesn't work, I tend to then go for tennis balls and self-mobilisation, self-myofascial release with tennis balls. So I would then do that on your piriformis and your glutes to see if that changes anything. And they're the main ones that I would usually go for. If none of them work, you could then go into a bit of a stretch of this instead, where you literally just take it forward and you hold that position there and take it into a stretch. I tend to find that works less often than the other exercises, but it's something that you can work on. And again, with this, it's just a way of giving you an idea of what's actually going on and where you need a little bit of work. So it's not perfect assessment, it doesn't tell you everything, but it's a way to give you an idea of what you can do a little bit more of. So again, with anything, you test, you do the exercise, and then you retest. Okay, work on one thing only and then retest. Okay, so we're getting more of an idea of where you need to focus on. We don't need to focus, we won't need to focus on every single part of the body. We're going to basically find our linchpins and make sure that that's where we set our focus on. So again, it's not perfect assessment, but it's one way of doing it. So have a go at the exercises, test, retest, and see how you get on.